We will maintain situational awareness to ensure the safety of both our patient and our crew. Right now, we're in a public space. There don't appear to be any more environmental concerns. This appears to be a mechanism of injury call, and I only see one patient. The patient appears to be a male in his mid-20s, lying supine under a tree. Sir, can you hear me? The patient appears to be unresponsive. Partner, could you request advanced life support respond to our position?
Dispatch, this is Falck BLS-1, requesting advanced life support to our position for a mechanism of injury.
I'm scanning the chest, looking for equal rise and fall, and palpating a carotid pulse. The patient's airway is patent. He's breathing regularly with good chest rise and fall. He has weak radial pulses, and his skin is pale, warm, and dry. Lung sounds are clear and equal bilaterally. The patient's unresponsive and requires immediate transport to a trauma center. I'm going to conduct my head-to-toe physical assessment before we prepare for transport. I'm assessing the eyes and palpating the head. The pupils are equal, round, and reactive to light. I don't see any decap BTLS on the head. I'm assessing the neck and palpating the back of the neck. I don't see any decap BTLS, jugular vein distension, or spinal step-offs, and the trachea is midline. I'm assessing the chest. I'm palpating the clavicle, using the base of my hand to check the sternum, and using a barrel hoop maneuver to check the ribs. I don't feel any decap BTLS or crepitus. I'm assessing the abdomen. I'm palpating each quadrant. There's no decap BTLS. I'm assessing the pelvis. I'm pushing anteriorly and inferiorly on the iliac crests. The pelvis is stable. I'll assess the genitalia once we're en route and we're in the privacy of the ambulance. I'm assessing the lower extremities. I'm assessing for circulation on each foot simultaneously. I'm starting at the hip and palpating all the way down to the feet. The pulses are weak in both extremities, and I'm unable to assess motor or sensory function because the patient is unresponsive. I'm assessing the upper extremities. I'm assessing for circulation in each hand and wrist simultaneously. I'm palpating from the shoulders down to the hands. The pulses are weak in both extremities, and I'm unable to assess motor and sensory function because the patient's unresponsive. Partner on the head, on your count of 3, we're going to log roll the patient toward me.
1, 2, 3.
Now I'm going to palpate down the vertebrae. I don't see any decap BTLS on the patient's back. Let's get the patient loaded up and go en route to the trauma center. Since the patient is unconscious, I'm unable to obtain an OPQRST or a patient's sample history. In this case, I'll take vital signs and reassess the patient's primary assessment every 5 minutes.
Thank you for reviewing this Falck Health Institute skill video. Please like and subscribe for future videos.